The first shot of the COVID-19 vaccine has been administered. Sanitation worker Manish Kumar becomes the first in the country to receive the first COVID jab at the All India Institute of Medical Science in Delhi. He was inoculated in the presence of Union Health Minister Dr. Harshvardhan moments after Prime Minister Narendra Modi inaugurated the drive. Frontline workers in Mumbai, Chennai, Bengaluru and other states have also got the first vaccine jab. As of now, two made-in-India vaccines, Covishield and Covaxin, are being used for vaccination. A total of 3 lakh healthcare workers will be vaccinated across the country. Today itself, 3 lakh frontline and healthcare workers to get the shot. AIIMS Director Randeep Guleria and Niti Aayog member VK Paul were also among the first few to be administered a jab of the COVID vaccine at AIIMS. 3 crore people, including 1 crore healthcare workers, 2 crore frontline workers, will be administered the first shot of vaccine in the first phase of this massive vaccination drive.
So it's the world's biggest immunization process. It's underway, and with us is Dr. Naresh Trehan, one of India's best-known doctors and the chairman and managing director of Medanta. Dr. Trehan, you just got your jab. What was the experience like, sir?
It's totally painless, so you don't even notice that it's gone in. I suppose there'll be some reaction as we go further. Now I have to be under observation for half an hour just to make sure there's no reaction, but it's very simple, straightforward, recommended for everybody.
So you recommend everybody should get this jab and as quickly as possible?
Yeah, whenever it becomes available to them, and I hope it will be soon because the supplies are coming up. So we hope that in the very near future the whole country will be able to get the benefit of it. And it's the beginning. Today is the largest vaccine exercise in the world. So this is a significant day, and I wish all of us who are getting it now, all the frontline workers, they have actually been risking their life for the last 10 months. So this is the beginning of the end of the pandemic. I think we will see the backside of COVID-19 in the very near future.
You've taken the first shot of Covaxin. How are you feeling, sir?
I'm feeling great. I took the vaccine about an hour ago, I guess. And I'm perfect. As you have seen, I have been talking, I have been happy, I'm proud, and I'm very happy, and I'm very happy for our great nation, and very proud of our great nation, which has demonstrated that we can fight this calamity of this size and unforeseen magnitude through our own efforts.
But those who, of course, have concerns about the fact that it is still in a trial stage, what do you tell to them?
I'll tell them that in unusual circumstances of pandemic, such as this one and previously in Ebola and other situations, scientific paradigm allows you to take extraordinary decisions. And those decisions are again based on logic. And invoking those decisions, the Covaxin has been given emergency use authorization. We are following the protocol prescribed by the drug regulator, but it is to be scaled up. It is to be given. We cannot wait. India has now choice of 2 vaccines, options of 2 vaccines, a stockpile which will come from two pipelines, and that we should be proud. We are happy. We have a much more robust likelihood of scaling up the vaccine because of having 2 vaccines at the same time.
I am feeling very proud and humbled at this point because I have been vaccinated and I was considered in the first lot to be vaccinated. It is a great moment for our country because we have now started the world's largest vaccination program, and we are very confident that it will be a smooth program and we will be able to vaccinate a very large number of people.
इससे ये होगा कि मैं कोरोना से अपने देश को लड़ने में फ़ायदा होगा। मेरे को अंदर से झिझक नहीं होगी जो कोरोना की होती है हमेशा से।
अभी कैसा एक्सपीरियंस है? आपने पहला जो शॉट था वैक्सीन का वो आपने
बहुत ही बढ़िया, आपके सामने ही हो, कोई ना इचिंग हो रही, ना खुजली, कुछ भी ऐसे नहीं है।
Give a strong message not only to the healthcare workers who are working along with me, who has been working very hard during this COVID pandemic, so they will be motivated that our own senior person is taking the vaccine without any hesitation. And I will request that a strong message. We are healthcare workers has been in the front line in managing COVID pandemic, and we will still remain the frontline people to motivate the community and the people in general that to come forward and take your vaccine.
Now, India Today spoke exclusively to Union Health Minister Harshvardhan after the vaccination drive began. Let's take a listen what he had to say.
आज से एक नई उम्मीद डॉक्टर हर्षवर्धन जागी है। पहले ये दिन और आपका पूरा अनुभव जो अभी रहा है, वैक्सीनेशन की शुरुआत हुई आपकी आंखों के सामने, क्या कहेंगे?
नहीं, देखिए, ये तो एक हमारे लिए एक भावुक क्षण है और एक बहुत ही संतोषजनक क्षण है, क्योंकि एक पूरा वर्ष हुआ कोविड के खिलाफ जंग को, और इस जंग में सारे देश ने पूरा साथ दिया। प्रधानमंत्री जी का पूरा मार्गदर्शन मिला हम सबको, पूरी सोसाइटी ने पूरी तरीके से सपोर्ट किया। हमारे जो डॉक्टर्स ने, जो वैक्सीन बनाने वाली कंपनियों के लोगों ने, और सबसे ज्यादा जनता ने जिसने क्लिनिकल ट्रायल्स में पार्टिसिपेट किया, इन सब लोगों ने 1 साल से भी कम समय के अंदर हमारे को 2 वैक्सीन दे दी। और आज दुनिया का सबसे बड़ा कोविड-19 के खिलाफ वैक्सीनेशन कैंपेन हम यहाँ भारत में शुरू करने की।
सैनिटेशन वर्कर से शुरुआत की आपने?
हाँ,
जो गुलेरिया को लगा, विश्वास जगाना सबसे बड़ी चुनौती हो।
शुरू जो पहला था वो इसी प्रकार से क्लास 4 के एम्प्लॉई से शुरू किया, नर्सिंग स्टाफ से शुरू किया, फिर एक डॉक्टर से शुरू किया, फिर तो ये श्रृंखला सारे देश में शुरू हो ही रही है। और आज देश भर में लगभग 3 लाख से ज़्यादा जो है हमारे हेल्थ केयर वर्कर्स जो हैं सरकारी और प्राइवेट सेटिंग्स में, उनको वैक्सीनेशन मिलेगा।
डॉक्टर हर्षवर्धन की बारी कब आएगी?
देखिए, डॉक्टर हर्षवर्धन अपनी बारी का इंतजार करेंगे। डॉक्टर हर्षवर्धन डॉक्टर तो हैं, लेकिन अभी किसी अस्पताल में मैं अस्पताल के हेल्थ केयर वर्कर की तरह काम नहीं कर रहा, इसलिए मेरी बारी आएगी तब जब देश को 50 साल से ऊपर के लोगों का वैक्सीनेशन मिलेगा। तो मैं अपनी बारी का इंतजार करूंगा, और मैं सारे देश के लोगों से भी यही कहूंगा कि धैर्यपूर्वक अपनी बारी का इंतजार करिए। जैसे आपने धैर्य के साथ, समझदारी के साथ कोविड एप्रोप्रिएट बिहेवियर को अपनाते हुए कोविड के खिलाफ जंग लड़ी है। जब आइसोलेट होने के लिए कहा तो आइसोलेट हो गए, जब सर्विलेंस के अंदर रहने के लिए कहा तो सर्विलेंस में आ गए, जब ट्रीटमेंट को ठीक से करने के लिए कहा तो ट्रीटमेंट ठीक से किया, जब मास्क को ठीक से पहनने के लिए कहा तो ठीक से आपने मास्क पहना, जब हाथ धोने के लिए कहा तो आपने ठीक से हाथ धोया, जब 2 गज की दूरी बनाने के लिए कहा तो आपने 2 गज की दूरी बनाई, चाहे गाँव में थे, चाहे शहर में थे, चाहे ट्राइबल एरिया में थे, सब जगह लोगों ने मिलकर काम किया। तो जिस धैर्य का और जिस ऊर्जा का, जिस सहनशीलता का, संवेदनशीलता का परिचय सारे साल भर देश के लोगों ने दिया, और जिस तरह से स्वयंसेवी संस्थाओं ने इसमें काम किया पिछले 1 साल में, तो अब हमारा वही लोगों से कहना है कि भाई अभी भी धैर्य रखिए, अपनी बारी का इंतजार करिए, आपकी बारी पे आपको भी वैक्सीन जरूर मिलेगी।
सर, एक सरकारी पुश है क्या स्वदेशी के लिए, सवाल उठ रहा है। ये सवाल इसलिए पूछ रहे क्योंकि लोग जानना चाहते हैं क्या चॉइस दिया जा रहा है, किसको कोवैक्सीन लगेगा, भारत बायोटेक वाला, किसको कोविशील्ड लगेगा, सीरम इंस्टीट्यूट वाला। ये एम्स में सर कोवैक्सीन लगा, इसके पीछे कोई वजह?
सर, ऐसी कोई वजह नहीं है। दोनों वैक्सीन स्वदेशी हैं, पहली बात। दोनों वैक्सीन भारत में बनी है। दोनों वैक्सीन बराबर सेफ हैं, इफेक्टिव हैं, इम्यूनोजेनिक हैं, और किसी भी वैक्सीन के बारे में किसी भी तरह की अफवाह पर देश के लोग विश्वास ना करें। जो जो वैक्सीन्स की अवेलेबिलिटी थी, जितनी भी मात्रा में हमें मिली, उसी प्रोपोर्शन में हमने सभी स्टेट गवर्नमेंट्स को दिया, और स्टेट गवर्नमेंट्स ने आगे अपने व्यवस्था के अंदर उनको वैक्सीन्स को डिस्ट्रीब्यूट करना था। ऐसा नहीं है कि कोई पर्टिकुलर जगह को ये वैक्सीन देनी है, एक पर्टिकुलर जगह को वो वैक्सीन देनी है। इस प्रकार की भी जो गलतफहमी है या इस प्रकार का भी जो दुष्प्रचार है, इसमें हम कतई ना पड़े। जो भी वैक्सीन हमें देश के अंदर मिलती है उसको हमें लगवाना है, और वो लगवाना हमारे को सुरक्षा देने के काम में और मजबूती प्रदान करेगा। देश को कोविड के खिलाफ जंग में जीतने के लिए हमें निश्चित रूप से और ज्यादा इसके अंदर कंट्रीब्यूशन मिलेगा।
There you have it. Our health minister stressing upon the fact that these vaccines are made in India. It's a huge push, a moral booster to the country which has been hit by the pandemic. And apart from that, for those naysayers, doctors today who've received the jabs have set by example. And our reporters today have picked up all that the sentiments, the way, the process of vaccination, the most authentic ground reports across vaccination centers in India. Let's take a quick look.
Frontline healthcare workers are now getting their shots, and we are at the prestigious Medanta Hospital. Two doctors who were involved in the war against COVID-19 are amongst the first to get the shot. With me is Dr. Arvinder Soin and Dr. Yatin Mehta at the Medanta Hospital. Dr. Soin, you were involved in this war against COVID-19 and you've got the shot. The Prime Minister today said that the nation is very grateful to you. What was your experience like, sir, getting the shot?
Well, the first shot was absolutely smooth and painless. And I'm honored to be among the first ones to be allocated a slot for getting the vaccination. And I think that me and my colleagues need to get this so that, one, we are de-risked because obviously we are at the highest risk being on the front line. But more importantly, we need to serve as examples for the rest of the country that they should embrace the concept of vaccination. They should not hesitate or be afraid. It is safe. We've just got it. We are doing well so far. And hopefully it'll go great.
Do we know what vaccine you've got? Does it make a difference whether you got the Covishield or the Covaxin?
Personally, to me, it makes no difference because both the vaccines are safe. There is some data which is expected from the second vaccine, which is the Covaxin. But the safety is not an issue at all.
So two doctors leading from the front, they've got the vaccine themselves and are encouraging others to take the vaccine, take that jab, which is being called the Sanjeevani of life. With cameraman Kripal Singh at the Medanta Hospital in Gurugram, Gaurav Sawant for India Today.
A big day today indeed. The vaccination drive kick-starts today. I'm at the Nair Hospital in Mumbai, and the people here are a special lot because they are the one who are going to receive the vaccine today, and they are going to, of course, set an example. But the first person at the Nair Hospital who's going to receive the vaccine is a lady here. Ma'am, many people have been, a little skeptical about whether they should be going for this vaccine or not. But you being a professional in the medical field, what are your thoughts at this point of time? You're number one here in the list. You will be taking the vaccine first.
Yeah, I feel that all healthcare workers who have been tested for COVID, because we also take tests in our hospital, whether we are positive or negative, then only we are allowed to work. So since I am COVID negative, I want to take this vaccine so that I am protected myself to give service to the other patients. And that is why I'm really excited to take this vaccine.
So look at the feeling, look at the mood of the people out here. As it is, the entire hospital has been well carpeted. There is rangoli all around. There are flower petals that have been shot at various places. All in all, a fantastic experience here at the hospital, and the bunch of people sitting here say they're happy and excited for the exercise. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
COVID vaccine has been initiated, and the drive as per that. The first vaccine was given to a health worker in Madurai, and the second one at Rajiv Gandhi Government Hospital in Chennai, and the second vaccine was given to the Dean of this hospital, Tenari Rajan. You could see currently various other people also, various frontline workers are also getting the vaccine over here, and this is a place where you could see actually all the setup was earlier done. 2 dry runs had been done already over here, and one by one the vaccine is being given to them, and the officials here have mentioned that the time span for the vaccines to be there is a maximum of 4 hours.
To build the confidence among the healthcare personnel, I wanted to stand first. That's why I took the vaccine first, and we are all very happy, and our healthcare personnel also, they are very confident now. I think today we were expecting only 25, but today there are 52 people have registered. So we are almost all the. I strongly feel that 100% coverage will happen in the healthcare personnel.
Wonderful. So after the vaccine has been taken, how long you have to be on the monitored now? Correct?
30 minutes. 30
only 30 minutes. That's the Dean of the hospital, Tenari Rajan, who has got the first shot in Chennai of the COVID-19 vaccine, Covaxin in particular, and he'll go to sit over there in that area. He'll be placed there for 30 minutes for monitoring. There are specific protocols as well. First 30 minutes, and even though he's the dean and he has to take care of various work in the hospital, he still decided to go ahead with the vaccination just to boost confidence. With camera person Divyan, Pramod Madhav for India Today.
Now, Prime Minister Narendra Modi launched India's COVID-19 vaccination drive, the world's largest inoculation exercise against the virus. He got emotional while speaking about hardships faced by healthcare workers during the pandemic and said that they sacrificed their lives for us. He further added that we have expressed our gratitude by reserving the first shot for them. Prime Minister lauded the medical fraternity for giving the nation 2 made-in-India vaccines in record time. Prime Minister cautioned people, saying that even after vaccination, one shouldn't discard precautions. Also warning against rumours regarding the vaccines. Nearly 3 lakh healthcare workers will be getting their COVID-19 shot today in 7 hours' time. 100 beneficiaries will be vaccinated at each session site. Prime Minister also launched the CoWIN app, which will be used for registration and tracking of vaccine beneficiaries right through this vaccination rollout.
मैं सभी देशवासियों को ये बात फिर याद दिलाना चाहता हूं कि कोरोना वैक्सीन की 2 डोज लगनी बहुत जरूरी है। 1 डोज ले लिया और फिर भूल गए, ऐसा गलती मत करना। और जैसा एक्सपर्ट्स कह रहे हैं, पहली और दूसरी डोज के बीच लगभग 1 महीने का अंतराल भी रखा जाएगा। आपको ये भी याद रखना है कि दूसरी डोज लगाने के 2 हफ्ते बाद ही आपके शरीर में कोरोना के विरुद्ध जरूरी शक्ति विकसित हो पाएगी। इसलिए टीका लगते ही आप असावधानी बरतने लगें, मास्क निकाल कर रख दें, 2 गज की दूरी भूल जाएं, ये सब मत करिएगा। मैं प्रार्थना करता हूं, मत करिएगा। ये भारतीय वैक्सीन विदेशी वैक्सीनों की तुलना में बहुत सस्ती है और इनका उपयोग भी उतना ही आसान है। विदेश में तो कुछ वैक्सीन ऐसी हैं जिसकी 1 डोज 5,000 रुपया तक में है और जिसे -70 डिग्री तापमान में फ्रीज में रखना होता है। -70 डिग्री। वहीं भारत की वैक्सीन्स ऐसी तकनीक पर बनाई गई हैं जो भारत में बरसों से ट्राइड और टेस्टेड है। ये वैक्सीन स्टोरेज से लेकर ट्रांसपोर्टेशन तक भारतीय स्थितियों और परिस्थितियों के अनुकूल है। यही वैक्सीन अब भारत को कोरोना के खिलाफ लड़ाई में निर्णायक जीत दिलाएगी।
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.